Hi, everyone. My name is John Faulkner. I'm the host of the Smarter Systems, Better Care podcast, and I'm here today with Adam Kustin. Adam is from Cary Health. He's an innovator at the forefront of healthcare transformation, and he's here to share fresh insights on advancing patient care and the future of health technology. Thank you for joining us today, Adam.
John, thanks for having me. I appreciate it.
Absolutely. Just to jump into the questions, could you tell us a bit about your background, your business model, and the clients that you serve?
Sure. So I've been in healthcare for about the last 10 years. I think you can tell by the grayness in my beard. That's not the entirety of my history here, but spent the last 10 years, give or take, in managed care, leading sales and marketing in the managed care arena. Currently for Cary Health, I lead growth for our health plan vertical. And, prior to that, I spent a fair amount of time in the advertising industry. And before that, very traditional consumer packaged goods and B2B marketing initiatives.
So it sounds like you have a long track history of like business development, and which is great.
Yep.
And then what's like the core focus of your business today, and like what role are you playing in driving that growth?
So Cary Health is a technology company, and we are supporting Medicare and Medicaid plans to identify and close open care gaps. And that has a very functional term in the managed care space, John, as you know, that stars and HEDIS measures, which all ladder up to either, compensation for the health plans or quality withholds against the health plans, depending on which line of business you're in. So we have an interesting technology that provides a lot of data transparency, data accessibility, and then the uniqueness for our offering is a lot of actionability on top of that. So we automate outreach to providers and to members to help them close those care gaps. And because of our technology, a closed loop system that allows us to very effectively report on the success of those care gap closures, and then the associated stars or HEDIS measure reporting. So, that's our focus. And then our sweet spot is specifically the pharmacy related quality measures, since our company about 8 years ago started as a pharmacy.
What are some of the pharmacy quality measures? I think most audiences are probably familiar with like hospital measures, but what about pharmacy in particular?
Yeah, there are kind of two broad pharmacy type measures. And I think for our conversation is probably where we should leave it, at, let's say, at 10,000 feet. So there are some pharmacy measures that are what I would call condition specific. So for instance, if you are a diabetic and on a statin, it's important for you to stay on that statin for the broader health and well-being of the member. So, there's the initiation of those prescriptions or medication consumption if you're identified as such. And then there are the adherence measures. So once you are prescribed a particular drug, that you stick with it, and that is measured by prescription refills and some other time-based measures over the course of a year. Those become super important, particularly in the Medicare space, because they have extra weight in the broader stars composite measure. So you encounter health plans that this is a 4 or 5-star health plan. Well, that's a composite of many, many measures underneath it. And some of those measures have extra weight. And the drug adherence measures are some of them that are what are called triple weighted measures.
And it sounds like it's really important, especially in the Medicare, Medicaid space from what you're describing for like
100%. There are dedicated quality or stars or HEDIS teams. They, go by lots of different names. They all are adjacent to pharmacy teams, all with a very clear focus on ensuring they hit those quality metrics. And I probably just glossed over it, John, a little bit, but they relate, to compensation, in the Medicare arena. If you are a certain stars level, you get quality bonuses, and if not, then not. So it becomes very important for those health plans to hit those measures.
Absolutely. And like if you had like 30 seconds for like to share your competitive edge, like what makes you unique versus other competitors? I just try to ask this question to provide perspective for people watching.
Sure. So identifying open care gaps for members is by no means unique. It may not even be distinctive. It's really table stakes. It is the fuel for the fire. What makes us unique is really two aspects of it. One is that the generation of that data then can automatically inform actions. So we have these automated omni-channel outreaches to providers that's totally under the control of the health plan. But you can imagine you could have dozens of these running simultaneously, all rules driven. That's part of it. And then the second part of it is that within the pharmacy arena specifically, we're licensed in all 50 states. So if a health plan wanted us to run, that last mile, take that prescription through the finish line, we can do the fulfillment on that. And then more broadly, I would say the way that we're able to or to enable our health plan customers to access and manipulate all of that data in real time or near real time, given our daily feed. That's the feedback we get from our prospects and customers, is that they really appreciate the autonomy they have. Rather than waiting on someone to generate a report, they're able to do that stuff real time.
It's amazing. So real time, there's not, it sounds like the other uniqueness is like, you don't have to wait a long time. There's not like a lag time, which is good.
Yeah, that's it. That's exactly right. The fuel for our engine is a daily feed of claims information, from labs to medical claims, facility claims, et cetera. And the combination of all those things just literally informs the daily calculations of who may have an open care gap, and if that open care gap was closed, because we see the behavior through the claims feed.
Excellent. It sounds like you got a really good closed loop system, which is good. Like it really minimizes it to almost non-existent, which is great. And then within this industry too, because I know this is very specific to Medicare and Medicaid within healthcare, but like what's one shift in this area that you think most operators or founders are underestimating right now that might not be seeing something happening that's like a big deal?
Well, I'm not sure if they're underestimating the implications, maybe the effort to get there. So there has definitely been a pullback. This is, not really news, but there's definitely been a pullback in how many 5-star plans are out there, right? So that the ability to achieve 5 stars is much more difficult now than it might have been 2 or 3 years ago. So ensuring that those interim, toll gates are passed in order to get within each of those measures. I mean, there needs to be more effort put on that. I think, maybe the underestimation. It's a really good question, John.
Yeah, no problem. Sorry, I threw a hard one at you.
Yeah, no, that's good, because as you're asking me, I'm kind of verbally processing what else is out there. There are a multitude of players, and it needs to be basically what I would call a coalition of the willing. And part of that coalition of the willing has to be the member. So, member engagement, giving them the information in the right format, at the right timing, at the right cadence, et cetera, to inspire them to take that action. If I say to you, John, you need to there's a refill waiting for you at CVS down the road, you still have to do something. I cannot literally put the pill in your mouth. And there are analogs to that all across the care gap chain. If someone needs a colonoscopy, or if they need a bone density scan or whatever, those things may only be activated with another element of the coalition of the willing, which would be transportation, for instance. So, if there are people who are transportation, insecure, that you have to include that in that equation too. So you had mentioned closed loop system. It is definitely a system. And I think that if you don't touch all parts of it, you've increased the level of difficulty dramatically.
Absolutely. Just closing those care gaps. And I've heard that term or phrase used across the healthcare sector. So I think we're all trying to do the same thing, just in our own unique way, which is great. So, and then, how do you see the industry adapting to these care gaps that you're trying to address, specifically like within Medicare and Medicaid?
The experience that I'm having right now is, folks have definitely leaned into the conversation. So I've been fortunate. I haven't been with the company that long, but I've been fortunate in the conversations I've had that I've heard, yes, this is a pressing issue for us. So I think there will be more energy around addressing those care gaps. I think that an opportunity for us in particular is to integrate other elements in what I'm going to call kind of the healthcare delivery value chain that into our platform. So for instance, one of the aspects of our solution is that we have agentic AI phone calls to connect with members to get them to take that action, whatever it might be, but helping them also make appointments using AI agents, helping them get transportation, helping them get, at-home testing delivered to their homes. There's all sorts of enhancements to what we can do for what I'm going to call kind of the last mile of care as it relates to some of these care gaps. So I think integrating vendors and we sit in an interesting position where with our technology through traditional, API communication, we're able to do that. And I think there'll be more of a reliance on a quarterback for these things than individual point solutions. And we're positioning ourselves as that quarterback.
Absolutely. And I heard you kind of mention some of the solutions like agentic AI. That's like a huge thing right now. Like, basically a team of like AI agents to kind of go out there and complete tasks automatically, depending on how you teach it or train it, right? Or the instructions you give it based on rules and that sort of thing. Um, I heard that described, but what are some other things that you're doing in your business to adapt to the shift to like fix the care gaps,
Yeah, yeah. So there, you know, I had let me double click on kind of the data accessibility part of it,
Yeah.
because this may be too nerdy for both of
Yeah.
us, but for the folks who are using the tool, it is liberating. And what's liberating about it is that literally at the member level on one screen, you can create a dimensional profile of that member. So you can see all of their inpatient procedures, any labs, chronic and acute medications, et cetera, through our generative AI tool that's embedded into our system. So why is that important? Is that the harsh reality of care gap closure isn't that you just, kind of clap your hands and make this thing happen. What happens is some human being or a tool, i.e. our platform, is reaching out to folks to get them to do something. And there may be a lag before they react to it. And the reaction might be that they call the health plan 2 or 3 weeks later to say, hey, you left me a message about, again, my medications, can you help me? There's no way that person on the health plan side is going to be prepared to receive that call without having all of the patient's information or member's information in front of them. And anyone who receives the call can see this information. So, it's not siloed data, which is a challenge that, all the tech players have been addressing for as long as technology has been around in healthcare, siloed information. So we create a very dimensional view of the member, which is an efficiency and effectiveness tool for that individual care manager to help the member do what's necessary, which might not be one care gap. It might be a multitude of care gaps. That's an example. We have another example with a tool that we call Claire. It's a clinical AI reference tool. So again, going very narrow here, there's an approach called MTM, medication therapy management, and we have an AI tool that will perform the MTM process for the clinical pharmacist inside of that health plan. It's a huge time saver. That's where we're using technology to really enhance the efficiency and effectiveness inside of the plan. And then outside, as we're engaging either providers, retail pharmacists, members, is using agentic AI to engage with them and at least get them to a point further down the road. It's definitely not a panacea. And we also limit its ability to do certain things like, give medical advice. We would never want to do that. So even if the final move is to get someone to talk to the health plan, someone who's qualified to engage with that member, person to person, I can't overemphasize the efficiency and effectiveness that we've been able to create through, the combination of these tools and techniques.
Absolutely. And it sounded like I heard you say too, there's some kind of human aspect to it as well to help these agents it sounds like the agents get some most of the way there, but there's always like a human participation element.
Oh yeah.
Well, yeah.
Again, John, and if folks aren't, in tune with the daily work might be somebody inside of a health plan making dozens of phone calls only to get busy signals or to leave messages. And today, a lot of that is happening with a human being. So that part, we're taking the load off of them. And the same thing for faxing, by the way. And I know everyone has all the smiles and jokes and winks and nods about faxing. It's a tool that, until it's not being used, we have to respect and regard and leverage, quite honestly. So just imagine a six-figure clinical pharmacist standing all day in front of a fax machine,
That's no good.
pushing stuff through the fax machine. It seems nutty, right? So once these open care gaps get activated inside of our clinical sequences, a lot of those, basic kind of mundane tasks, blocking and tackling, happen automatically, which allows everyone to level up. And that's also important because I don't see health plans adding more people. I see them adding more technology to get those people to be more efficient and effective, which, again, is a story of the history of the world, right? So we're just layering on top of that philosophy.
Yeah. And then kind of jumping into like your systems and efficiency, fulfilling your own gaps in your company. What are like pain points in your operations today? Are you experiencing things like that, or you guys feel like you're getting things pretty fine tuned?
Well, I don't certainly. First of all, I don't know what I don't know. So, the person sitting next to me might be pulling their hair out while I'm just, smiling, right?
Yeah.
The company's been around for about 8 years, and we're a pretty high growth company. Last year, we were number 82 in the Inc. 5000 list. So, whatever kind of basic rubric you'd apply to high growth companies, we're challenged with that. But I will tell you, we've been very thoughtful about adding systems and people at the right times. Particularly, my seat is in sales and marketing. We have implemented what I think are world class tools to support our efforts. Mine are much more fundamental and foundational, which is I want more of me out there, shaking hands and kissing babies, which is, the diametric opposite of AI, by the way, is that, the irony here is that in this space, Medicare, Medicaid sales happens face to face, happens belly to belly. That's, it's a scaling issue we'll have to deal with. But I think operationally, it feels very stable in our organization. We have a pretty good plan for how we're managing our growth.
Excellent. And then like marketing sounds like it's in a good place. There's like any gaps in like following up with people, or because you're growing so quickly, which is a good thing.
Yeah.
But is there like, does anyone get lost in the cracks in that process, unfortunately? Because I know that may happen from time to time.
It's a great question. I could tell you we're not there yet. I don't think, we haven't overheated. I would say that it's warm, but I don't think we've overheated. I think what's going to happen, and then either we'll get ahead of it or we'll be hurt by it, is our marketing has not matured to a point where we're getting a lot of inbound leads. And I think that's where the thing you're describing is an opportunity for, it's a bit a moment of truth for us. Either we're going to do it and be able to accommodate those additional inquiries, or we're going to disappoint people. So talking about it and preparing for it, I think is, at least part of the battle there. But I would tell you right now, we have a pretty good balance and cadence. And John, you know this likely as well as anybody. There are no impulse purchases in the managed care arena. They're very long sales cycles, very relationship driven. And particularly with the big players, the Molinas and Centenes and Elevances of the world, you're going through multiple, kind of geographic accountabilities and operational accountabilities to get to a yes. So we've been able to manage that so far, but once we continue to cast a wider net, which is really happening in the back half of 25 and 26, we'll need to put the systems in place to accommodate the additional, hopefully the additional interest.
Absolutely. And then like, what's kind of continuing to that? What's working really well for you guys right now? You guys just feel like you're hitting it out of the park?
Well, there are actually two lines of business for our organization. I'm running the health plan line of business, and then we also have life sciences. The origin story for our company, Cary Health, which by the way is shortened from apothecary, is that we were founded as a digital retail pharmacy, and then that evolved into these two lines of business. Specialty pharmacy, which I applaud their work all the time, but I'm not involved in it. And then of course, there's my side of the equation. I would say on specialty pharmacy, what's working is that we have an interesting story to tell, and our metrics are really good in terms of fill rate, refill rate, all those sorts of performance metrics work really well. I would tell you what's working well on the health plan side, and it sounds so primitive, but also so important, is that getting first and second meetings based on brief conversations means there's a there. And then, of course, you go through the much longer process of demonstrating differentiated value, which is what I'm doing right now. I would also tell you that we've had vendor conversations, and I talked about the last mile type stuff. There are other vendors who are adjacent to us, but playing on the same field, who are interested in partnering with us. And I think that's another indicator that we have something special, and I really believe we do. A lot of the feedback I get in my pitches are very exuberant, and typically you don't see that. People are reserved about what kind of feedback they want to give, but a lot of exuberance in the pitches, because going back to that, accessibility, flexibility, immediacy of what we're able to help those health plans, address and accomplish.
Excellent. Well, that's great to hear. And
I don't know if I answered your question, John, but I felt
you definitely did. Yeah, I'm just interested, like how you're measuring success growing so quickly, and then do you have like specific metrics that you're looking at in your business, or like how does that work? Because you have like the health plan side, but then you got the kind of the pharmacy, specialty pharmacy side too. So.
Right. So the specialty pharmacy side of the equation is much more mature than the health plan side of the equations. I'm drafting on those guys right now. My accountability is to catch up to the life sciences side. I will tell you, and I used the term primitive before. I mean, my primitive metrics right now are am I getting, and I won't give you the number, but am I getting enough meaningful meetings? And are those meaningful meetings advancing down what's a pretty known pathway or cadence in the managed care sales space? And I would say absolutely. There's been very little fall off in the conversations. I'm not sure when this podcast will air, but it is August 1st today. A lot of folks are distracted by things that are outside of work, because it's summer, so you have to be cognizant of the pace that's happening there, but we are advancing a lot of these conversations, and that gives me confidence that we're saying the right things and that we do offer that differentiated value.
That's amazing. So you're definitely
Still
making,
early days for some of this stuff.
yeah, it's interesting call out too. The time of the year, people are on vacation or they may not be around, harder to reach people,
Yep.
more laid back. And
Yep.
then once the school year starts, people are more in like the let's get it done,
Yeah, 100%. And then what happens right after Thanksgiving? They're thinking about it again, which is they're not thinking about me. I want them to think about me, but they're thinking about friends and family. So
Exactly.
totally get it. Yeah.
Yeah. And then just kind of as we're getting to like the end of our podcast here, what is the next 6 to 12 months look like for you guys, like in the health plan space? Because I know that's your big growth area.
Yeah. So for me, as physically and metaphorically being the tip of the spear, it's a lot of evangelizing. It's a lot of getting out there. And I go back to my earlier commentary about face to face. I spent a lot of time at state level and then some national conferences. It sounds base, but work in the room. And I truly believe in telling the stories and finding people who, based on title or organization or contacts from the vendor group or groups that I'm associated with, making those conversations. So the back half of the year is just going to be more storytelling and getting people excited about Cary Health while doing the question you asked before, which is to do all that follow up and keep on advancing those conversations. And I expect to add a couple of folks to my team before the year is over, and then I think that will give us the leverage we need to really knock it out of the park in 26.
Absolutely, for sure. And thank you for joining the podcast. I really appreciate your time. How can people reach out to you? Like, what's the best way to connect with Cary Health?
Well, the best way to connect with me is my first name is Adam, and I'm at Cary.health. And despite the protests of my wife, I check my phone all the time. So you send me an email, I am going to respond. I love this business. I love the company. I love what I do. So, it is as much a hobby as it is a job. And I'm very, very grateful to be on this podcast, gratefully part of this organization. So that's the best way to reach me. And you can, of course, check us out at Cary.health as well, and get a flavor of who we are and what we do.
Excellent. Well, thank you for your time today, Adam. Really appreciate it.
Thank you, John. I appreciate it too.
Thank you.